Sotagliflozin is a dual SGLT1 and SGLT2 inhibitor. It is currently approved as INPEFA for the treatment of congestive heart failure. I think it was 5 years ago that the company tried to get the drug approved for the treatment of type 1 diabetes, in addition to the patient's insulin, and it was rejected at that time. In October, the company again tried to get approval for sotagliflozin for the treatment of type 1 diabetes in patients who have both type 1 and chronic kidney disease. Because the SGLT2 inhibitors, Farxiga and Jardiance, are currently approved for the treatment of chronic kidney disease to prevent its progression. And although those drugs are not meant for the treatment of type 1 diabetes per se, they can be used with caution in those patients. Now, the company tried to get this drug approved specifically for patients with type 1 diabetes for the treatment of type 1 and to prevent progression of the kidney disease. In October, the Endocrinologic and Metabolic Drug Advisory Committee said that the benefits are not outweighed by the potential risks. And so, not surprisingly, just recently, the FDA did decide to reject it again. The primary concern is for diabetic ketoacidosis, DKA. We do know that the SGLT2 inhibitors, Farxiga and Jardiance and Invokana, do increase that risk, even in patients with type 2 diabetes, but more so if patients have latent autoimmune diabetes of the adult or LADA, and in patients for whom it's being used for chronic kidney disease if they have type 1 diabetes. So those drugs need to be used with caution, and that is also the concern of the committee and the FDA, which is what with sotagliflozin, and that is why it has been rejected. Now, I think that this is unfortunate because we do need something in addition to insulin for patients who have type 1 diabetes, especially people with chronic kidney disease. And although there is some risk involved, now, of course, this is just my personal belief, I believe that in selected patients and with the utmost of caution, that these medications can be used safely. At the moment, sotagliflozin has been rejected by the FDA.